right, hello everyone. Good afternoon. Thank you so much, Nina. Again, I'm Denise James Green. I currently work at the Orlando VA as a nurse practitioner and a certified wound and ostomy nurse. Today, I'm excited to share with you how I utilize the Round Plus and Get Well Network education platforms to assist me in my quality improvement project, enhancing post-discharge ostomy care for adults. So today I will discuss the opportunity that I identified, which is gaps in the discharge process. We looked at the solution, which was to create a needs assessment and quality of life survey, which was housed within the Rounds Plus application. And then the importance of the survey was to determine the veterans' needs and their desired outcomes to improve the ostomy education post-discharge. The outcomes were to identify the needs for more education and the desires of the veterans, professional development and training of all the wound and ostomy staff on Rounds Plus and the Get Well inpatient solution, have designated order sets and a designated wound and ostomy tile space for current and future educational opportunities. A little bit about the Orlando VA facility. The VA Orlando healthcare system was established in 2006. We serve a population of more than 198,263 patients, veterans in the Central Florida area. We are the fourth largest VA medical center in the country, and it is part of a 650-acre health and life sciences park known as the Lake Nona Medical City. Our facility provides 370 operating beds, including a 120-bed community living center and 2 residential rehabilitation programs in the Orlando area. Our wound clinic is a nurse practice-led clinic. We have 5 nurse practitioners. We have 1 clinical nurse specialist in the CLC and 1 RN. So our project goal, again, was to improve the post-discharge care of adults living with an ostomy. And why is this so important? Well, just a little bit of background and significance is that approximately 1 million people are living with an ostomy. And this number just continues to increase with early diagnosis of colorectal cancer, early screening. We're seeing patients being diagnosed earlier in their 40s and 50s. Most of the complications occur within the first 30 days after surgery. The most common complication is peristomal dermatitis. And in the first 30 days, 20% of the patients that did visit the emergency room, some of these visits could have been prevented by having that pre and post-discharge ostomy care. Identified that there was no ostomy group within the Central Florida area in the beginning of my project. Currently, there now is a ostomy group in the Central Florida area. And then I also did email out to our national group, Wounded Ostomy Group, asking if any of them provided what type of education they provided, if they had any kind of support groups. And there are only 2 VAs across the facility that did have actual identified ostomy support groups. So the project design and method was to complete a qualitative and quantitative data analysis. Now, of course, I did a comprehensive literature review, completed it, and the literature stated that patients who received education pre and post surgery had better outcomes. They adapted to living with an ostomy better. They had fewer ER visits and fewer peristomal complications. So the critical factor to this project was to ask the veterans what they experienced and what they needed to help improve the post-discharge process. And as part of my DMP project, I worked with the education department here at the Orlando VA to ensure first that I could complete the needs assessment. I wanted to gather information, keeping it in a positive way. I wanted to get a good sample size. I wanted to collect the data in real time. And I wanted it housed in a platform that would be safe and secure, fall within the HIPAA guidelines, as well as follow and outlined in my IRB approval. So at that time, I was introduced to Lizette Dubois, who is the Get Well Network Client Success Manager here at the Orlando VA, who was very instrumental in assisting me with completing my surveys. She introduced me to the Rounds Plus application. We worked together. I had developed the surveys, so we worked together to input the surveys into the Rounds Plus application. Now, Lizette would have to speak to you about how she actually inputted in there. I didn't do any of that. I just gave her the information that needed to be put in there. She helped me to make sure that it looked good in there, how the design would look. She taught me about the Rounds Plus, how to utilize it, how the surveys would come out. And she was just very knowledgeable and helpful in helping me get those surveys, how it needed to look and implement it into the application. Then the next step was, okay, how am I going to give it to the veterans? Well, she also provided me with a Rounds Plus iPad. So this iPad was great. I had the iPad within the clinic. I logged into it. I opened it up. The surveys were right there. We just had to click onto the survey. The veteran was able to answer it, submit it. The next survey, the same thing. So it was all housed into that Round Plus iPad, into that Round Plus application. And so again, that was very streamlined. Lizette was readily available for me to email her. You know, after the first week of doing a few surveys, we went in, we looked at it. Was it capturing it okay? Was it looking okay? Were the answers, you know, being captured correctly? We weren't missing any information. And she was always readily available to me by IM or email. So once I completed that 3-month survey process, it was time to collect the data. And I don't know about you guys, but sometimes doing data collection, I have a little anxiety, and sometimes the process can be a little bit difficult. So next. So this was the outcome of my survey process. So I was able to find out what the needs and the desired outcomes of the veterans were. And as you can see here that, you know, 52% of them answered that they'd like to have an ostomy education group, and 52% said, of course, in-person ostomy education. We also were able to, based on the surveys and the survey questions, identify other gaps and concerns that the patient's anxiety that they were having. But what I really liked about this application was how the data, after collecting the data, how I could extrapolate it. So you can see from this graph here, and again, Lisette walked me through this. She sat me down. She showed me exactly how I could go into the application. I could choose how I wanted it by Excel spreadsheet, by a bar graph. I could do it by months. The answers, each question, I could do a bar graph for each question. And here you can see that, I don't know if you can see it that well, but each question and then the answers has the number of people that answered that question. So it was just great. I was able to identify the needs, identify the questions, and just see, again, very easy, very streamlined. So to ensure that we provided, you know, the needed education to our patients after collecting this data, we reviewed the current videos and education that was within the Get Well network. And again, with the assistance of Lizette, we had a designated order set that was created for specific ostomy education. Then all of the wound and ostomy team was trained on how to access the education and assign the education, not only in the room, but now we could assign it from our desktops. We could also monitor the education and see if it's been completed. We could send reminders from our desktop, letting them know that, hey, you have education that needs to be done. And then once the education was completed, then it's documented in the EHR. But what's also helpful is that we float between the clinic and the hospital. So if we were providing education, we can go and we can look into the Get Well network and see what education was given, did they complete it, and what needed, what we needed to do to reinforce, what questions we could ask. We say, hey, I saw you watch that video. Did you have any questions about that video? And then we could do that reinforcement and that follow-up that was needed. And if they had any other questions, any other videos they wanted to watch, we could assign those as well. So here you'll see that the order set on the right-hand side, very streamlined again. So you can go in, you can easily see these are the colostomy education. They're grouped together. What is the colostomy? You know, what is your care here? You can do this right again from the desktop, go in, click whichever you want. It's sent right to the patient's room. It gives them the little note that says, hey, you have education waiting for you. And then we did notice that there were one little limitation. It didn't have a full education related to urostomy. So again, Lisette said, hey, we can create a tile for you where you can house other education. And so this was fantastic. So now we have our own wound tile. We've implemented the urostomy education that was needed under here. But what's great about this too is that we can also add other education. So one thing we could do as a follow-up is from the survey is saying that the patient veterans wanted to have an ostomy education group. So we can also add that to this tile stating when the group is, when it's being held, and also a phone number that would be related. So again, this is very streamlined and very easy. So looking forward, I just have to say, without Lisette and without the Rounds Plus and Get Well, I wouldn't have been as successful in my DNP project because, again, this, implementing the ostomy education group now, I can look forward. I can do a post survey, again, utilizing the Round Plus application and asking the patients, hey, what we've implemented, is it working for you? I can look and see, are there outcomes being positive? So we can do that again through that survey process and using that Rounds Plus application. The future education that we deal with chronic issues here in our clinic in the inpatient and outpatient side. So adding some of those under the tile as well, for example, patients with lymphedema, we can provide lymphedema education. We can also provide education about pressure injury preventions. So looking forward to, we can continue to utilize the Get Well Rounds Plus inpatient education platform for not only just ostomy education, but for the other chronic issues. So the success of my project and ongoing expansion and improvement has been a collaborative effort between myself, my team, and Lisette. I look forward to the ongoing collaboration and potential growth and positive outcomes that will benefit the veterans living with an ostomy and enhancing the post-discharge education. Thank you.
All right, thank you so much, Denise. That was awesome. We really liked hearing how you did the project and how Get Well assisted you in the data collection and made your life a little bit easier. I don't see any questions in the chat, but if there are any questions, please feel free to reach out to us after this presentation. All three of these email addresses are valid, and you can reach out to us through any of them. And I will share the slide deck with whoever provides their email in the survey after the webinar. Okay, so now I'd like to introduce Jackson Clement. He is the Director of Government up at Get Well with us, and he will be walking you through the Get Well Anywhere federal platform.
Thank you, Nina. Well, it's awesome to be able to be with the group today. At long last, after about 2 or 3 years, we are now live today with our FedRAMP authorized cloud-based Get Well Anywhere platform throughout much of Vision 4. And as I'm sharing my screen, I will let you all know that for you all on the call with an on-premise solution, it means a couple of things. There's going to be a number of enhancements, both to the current features as well as new modules that you'll be able to take advantage of. And they break down into 2 categories. So the first category is on the left side of the page. There are 2 new screens inside of the inpatient setting that will be able to display information to patients, staff, and caregivers. And then on the right side of the page, there is a new set of veteran-facing mobile modules that'll be able to help to guide your patients on their own smartphones throughout the ED, the inpatient setting, and the days post-discharge. So let's actually start on the inpatient side. Get Well Inpatient on the left, of course, you know us there. That's the solution that's implemented today, not new. Signal in the middle is new. And Signal is the digital door signage. So it's nothing more than an iPad that is kind of mounted outside of the patient's room. And it's a always up-to-date, consistent feed from CPRS. And so it's able to display relevant information about each patient to staff and visitors as they are entering the room. Things like falls risk, droplet latex allergies, MPO status, right? Anything that you want to be able to display to visitors and staff members can be done outside the room. And then once you get into the room, we have a standalone whiteboard. And the standalone whiteboard is a separate second smart TV that could be mounted on the wall next to the patient's smart TV. And it could actually replace the existing whiteboard that's manually updated at shift change, because it too, like Signal, is an up-to-date constant feed from the EMR to display information to patients like who's going to be taking care of me, what's planned for my day, what are my goals, falls risk, pain levels, notes, anything that you want to be able to show to patients can be done on the whiteboard. So that's it on the inpatient side, and shifting gears to those mobile modules, beginning on the left-hand side of the page with Loop. And Loop is the at-home, on-the-go, veteran-facing mobile module. So your veterans would be able to access it and interact with it on their own phones and computers at home. And what Loop will do is Loop will enable you to extend the reach of your inpatient solution to be able to guide and navigate, stay connected with, educate patients throughout that bulk of a time inside of a healthcare episode where they're not physically in your hands, kind of in the days leading up to a planned procedure, as well as the days post-discharge. And what Loop will do in practice is Loop will automatically and proactively reach out to everybody on the system, kind of a proactive push of information, a text message or an email on a daily basis, either daily or near daily, both in the days leading up to planned procedures, to make sure that expectations have been set properly and that all the preparation and the prehab activities have been done. And then it's also importantly going to continue to follow up with your veteran patients post-discharge on a daily basis to make sure that everybody's on track, that they're following doctor's orders, sticking with their follow-up appointments, that they're taking their medications properly, and that they're monitoring themselves for any signs and symptoms that might indicate risk, so that we can, in the middle of the page, provide your staff members, your PAC teams with a real-time window into how all of your patients are doing, so that they can kind of spotlight the folks who are most at risk and be able to, on the right side of the page, kind of focus their limited care team bandwidth specifically on the patients who need help most. So at a top line, that's how Loop is going to interact with both the patients and staff members, so that you know this Loop tool is actually a growing library of over 300 different loops or care journeys. 2 of the 300 are general in nature. So there's a general ED and a acute care discharge care plan that are able to meet all of your patients leaving one of those settings of care. But the rest of the 300 get very specific. So there's everything from CHF, COPD, things like diabetes, hypertension. There's a lot of planned procedures from total hips and total knees to colonoscopies. So we're really able to cast a wide net and or we can go very narrow and deep into a specific patient population. So that's Loop on the left-hand side of the page. The ED mobile experience is also a veteran-facing mobile module, but that journey starts in the emergency department. And it's easier to show you here. So our example patient here, her name is Catherine. Catherine shows up to the ED. She checks in at the front desk, which automatically triggers a text message to her phone here. And so as she's sitting down, she opens up the link, which links her into the ED experience, which first and foremost is going to set expectations. Like, what are the 5 items that are going to happen to me, the 5 steps that are going to happen to me over the next number of hours in the ED? So kind of setting expectations clearly up front. And then once expectations are set, to help to reduce the fear of the unknown, let's distract them, right? Let's actually allow them to watch those Hollywood movies that, as you all know, have only been available up until this point inside the inpatient setting on the smart TVs. Let's actually allow your patients in waiting rooms to watch all these movies. And then there's everything down below. There's areas for health education. There's relaxation videos, dining options, surveys, all kind of things that are important to patients inside of a waiting room. And then when a patient is admitted, I should say, if a patient is admitted into an inpatient bed through the ED, this experience flips and turns into get well inpatient on their own device. And so the device and the experience will sync up with the smart TV on the wall, and patients and caregivers will have the opportunity to either consume and interact with the content on their own phone and or the TV as well. And then once a patient is discharged, Loop takes over and we'll send a text message to all the patients. This is an example, kind of 1 day post-discharge, where she gets a text message linking into a survey here, asking if she has any questions about discharge. We'll answer no here. Were you able to fill your prescription? Yes, it's been filled. Do you have any questions about your scripts? No, I don't have any questions. Have you scheduled a follow-up appointment? Right, I've answered positively to all of these things, but if I ever did a negative answer here, or as a patient digitally raised my hand saying I need help, that could actually fire an alert back to the clinician dashboard that could be monitored and acted upon. And in the event that you actually don't have the bandwidth on the back end to be able to open up the door to new patient information, we could actually configure this tool to have the very next page inside of Loop here be explicit instructions on what they should do next. In many cases, that would be to call a telephone number, might be to link to My Healthy Vet. The key being, though, is that if we configured it that way, the onus would be put completely onto the patient as opposed to the care team. So that kind of finishes the Loop 1 day check-in and the mobile modules here. Let's go back to the slideshow. So we covered Loop, we covered the ED mobile experience, Rounds Plus. Now, I'm sure everybody on this call at this point knows what Rounds Plus is as the clinician-facing rounding tool that enables us to transition paper-based rounding checklist audit processes over onto an iPad. And with the FedRAMP ATO, there are usability enhancements here, namely the fact that we're going to be able to integrate Rounds Plus with CPRS and Vista. So what does that mean? It means that as the rounder, I can actually have my entire patient list populated here from the EMR. Furthermore, it will color code the patients red, yellow, and green. So patients that are in red have triggered alerts in the past that have not been followed up on, right? That could be alerts from previous rounds, or it also could be alerts that were generated from their activity data that they've put into Get Well Inpatient in the comfort of their own rooms, right? That might come in the form of a service request that's been placed to EVS and hasn't been solved yet. Might be a rare service lapse that's actually been uncovered using the Get Well PXP surveying tools, so that as a rounder, I can first of all prioritize my time. Maybe I just want to hit my red patients first. And then prior to walking into the room, I can actually open up the patient profile and have a little bit of context about what might be front of mind for patients based upon that activity data, so that I as a rounder can fix issues up front, address issues up front, and not be blindsided. So that's the key kind of usability enhancement for Get Well Rounds Plus. And that kind of concludes the overview of the enhancements. And next steps. So you're going to get a survey after this call. And if anybody's interested in learning more about any of the additional modules or enhancements, you can put your email into that survey. And I should say, and/or you can contact your CSM. Happy to set up a call.